Probably now number 51. You could bring her up on the chair if you want. She'll sit there. She likes being petted.
Yes, she does. Okay.
Okay, so if the government gave a stipend for dental care, this one, Laura Lynn, really good. If the government gave a stipend for dental care, would it save a lot of money and save people's lives?
Yes. I think well, the government's always saying, well, we don't have money to give everybody health care. And everybody's saying, we don't want our taxes to go up to give everybody health care. But I say if they give everybody dental assistance, a stipend or something towards dental care.
And it would have to be a large stipend to cover. It can't be like, oh, we'll give you $20 off when like a root canal is like $600. I mean, it's got to be like reasonable. Even just dental.
And then if you have a root canal, you have to have a crown on top of it, and that's another $1,000.
Yeah.
So that's a lot of money.
Well, even just dental. Go ahead. I interrupted you. Sorry.
Dental cleaning. I went and had my teeth cleaned, and that was $125. But if you don't have your routine dental care done, and you constantly have a low-grade infection in your mouth, you swallow that infection, and that causes heart disease and other problems. And then people end up having a heart attack, and they go into the hospital with a heart attack and get emergency Medicaid, and then the state has to pay for their heart attack. When they would have been further ahead just to pay for the dental cleanings
Which is so inexpensive. Of all the medical care, dental care is the least expensive medical care.
especially just the preventative.
Yeah. A simple cleaning, a simple go in and floss type of thing.
And if they would have had assistance with the dental care, because think about it, if somebody is having a hard time putting food on the table, are they going to take their $125 and buy groceries, or are they going to go get their teeth cleaned?
Yeah, I'm buying groceries.
Yeah. If somebody is having problems paying their electric bill, are they going to take that $125 and clean their teeth, or make sure the lights stay on?
Yeah, everybody would say keep the lights on.
Keep the lights on. So people aren't having their dental care because they can't afford these other necessities. Yeah. And so they run around with a low-grade infection in their mouth and tip over of a heart attack, go to the hospital, get emergency Medicaid, and then the state gets to pay for that.
Well, also another thing is there's a couple other things that would add into this. Because you got a cycle of neglect of teeth, it becomes generational. They don't realize how important dental care is. Right. Because their parents didn't know, and their parents didn't know because their parents didn't know. They didn't know. They might not know about flossing. They might not know that you're supposed to go every 6 months and get a cleaning. They might not know, like, what is plaque? How do we prevent plaque? How do we best take care of our teeth? They might not know about the acid in soda pop just eroding your teeth, or oranges, eroding. They might not know and as the generations go on, dental care becomes less and less of a concern just because of generational neglect, ignorance. And it's not purposeful. Most of the time it's just they couldn't afford it.
Right. When I was going to school, I went to school in the 80s. And in the 80s, even in elementary school, they would have a dentist come in and talk to the class, tell them about flossing, tell them about brushing, and they had a model of a mouth and a big toothbrush, and they showed us kids how to brush. Back then it was circular motion, brush in circles, brush in circles, brush in circles, and then
what is it now?
Up and down.
Okay.
And
I
then there,
still do the circles though.
and then there for a minute it
Oh
was.
no, I do side to side.
Yeah, there for a minute it was side to side. They're saying side to side is the worst way you can brush your teeth because it causes erosion of the enamel at the gum line, and you'll see a lot of times people will have cavities at their gum line. It's from brushing side to side. So now, yeah, when I was going to school, it was circles. Brush in a circle, brush in a circle.
Yeah, it's
brush
one
in
of
a
them
circle.
things that every 20 years or probably 10 years they're gonna say something.
Yeah, they
different.
change it all the time. Just like my mom said that when she had her first kid, you're supposed to put them on their back to sleep, and then when she had her last kid, they were supposed to put them on their
the
stomach
side.
to on their stomach to sleep.
Yeah, I remember
And
the
then
stomach.
when I was having kids, you were supposed to put them on their side with
Yeah, the
no
side.
pillows and no
Yeah.
blankets.
Yeah, that's what I was. That's the side. You were supposed to put on the side, not the back, not the stomach, the side. No blankets, nothing that could suffocate them.
Yeah.
Nothing that could tangle in or could cover their mouth. Yeah, who knows? You just do the best you can with what you got. But another thing, if you go to the dentist, they always give you, sometimes a choice, sometimes all things, new toothbrush,
Yep.
dental floss, and
Toothpaste.
toothpaste. Yeah, toothpaste. And this really helps. Like people, they might forget to get a new toothbrush. I forget all the time. I'm probably using the same toothbrush for 3 years. I don't remember. You know, but the dentist will hand me a toothbrush. Oh yeah, that's right, I need a new toothbrush. Or like dental floss. Some people can't even afford, or it doesn't pop into their mind to get, to even floss. Because I'm going to be honest, the only people I knew who flossed was nobody growing up.
Right.
Nobody flossed. The wackadoos flossed. That's what, I didn't know anybody who actually flossed.
When I was growing up, my mom had floss,
Mhm.
but it was only for if she ate popcorn and got a kernel stuck in her gums.
Exactly, yes. Like if you ate meat or something and it was stuck in there.
Yep. And
But then
she-
when we went to the dentist, they did a full cleaning floss.
Yep.
So that's another good thing that's good, they'll just totally, floss you.
I floss only once a day. I know you're supposed to do it twice a day, but I only do it once a day.
I do it once a day, sometimes no a day, and I usually only brush once a day, usually. I'm not good with dental hygiene. But I'm a lot better than I used to be with my flossing.
I brush a lot. I brush when I first wake up. I brush before I go to work. And then I brush before I go to bed. So I brush and floss before bed.
Yeah. I floss whenever I think of it or when I'm near the floss, but that's it. It's like I gotta be near the-
I have it in my nighttime routine before I go to bed.
See, that's a way to do it. But yeah, I think a lot of doctors, because they're so separated. You got your school of dentistry, and everything's becoming specialized. So for example, I had vaginal eczema. Don't hate me for the pronunciation. I call it eczema. You call it what you want. I had vaginal eczema and for years suffered from it. Never crossed my mind. I had eczema as a kid, just constantly. It was really bad. Never crossed my mind that what was going on.
Was your eczema?
Yeah. Never crossed my mind.
Well, why would it? I didn't even know you could. I mean, it makes sense. That is skin. And anything that affects skin could affect that skin. But it's like...
I never thought of it.
I would have never thought about it.
It never dawned on me. It never crossed my mind.
It never would have on me either.
I mean, if somebody said it, I would say, oh, okay, yeah, that might be it. But it never crossed my mind. And I was going for biopsy at different doctors, different gynecologists. They knew I had eczema. It's right on my chart. They never said it might be that.
Oh my gosh.
They never said it might be that, and I was getting biopsies even.
They were using you as an ATM machine. Cha-ching!
Yeah, no joke. And then it was one thing that it just crossed my mind in my mid-40s. I was like, that might be eczema. And so, click, 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 by that time we had the internet. Click, click, click. A lot of women complaining about vaginal eczema.
Wow.
And same problem, their doctors did not diagnose it. They never mentioned that it could possibly be it, and they do not know how to treat it. Because the specialties are so separated. You got the school for gynecology, and then you got the school for dermatology. Never the twain shall meet.
But that is made up of skin.
Yeah.
That's a different kind of skin, but it is skin.
But your dermatologist doesn't even have the equipment to do a vaginal exam.
They don't. They leave that up to the gynecologist, but the gynecologist doesn't know anything about skin.
Yeah. So, yeah, for years, and this is why I don't trust doctors as much. Another reason, one of the many reasons I don't trust doctors as much as people say you should trust doctors. Because, especially now that everything's so specialized,
Yep.
you got, you used to have the general practitioner. Well, that's going the way of the buggy whip. Everything's specialized. And even especially your dental. Your dental is just a completely different school. A lot of people don't even consider them doctors. A lot of people make jokes that dentists aren't doctors.
A lot of people make jokes about chiropractors not being doctors either.
Yeah, and being like pseudoscience. It's like, the only reason I can go to the bathroom is because of the doctor. The doctor, the chiropractor, who I call a doctor. Because of that, adjustment in my back that needs to be done every month or two.
Yeah. So here's some homework for you in the audience. Here's some homework for you. Somebody told me that for a dentist to become a dentist, he has to go through medical school first and then go into dental school.
I never heard that. But it might be true. I don't know. I never researched it, though. I never inquired.
I never have researched it either, so that's why I'm giving them homework. They can look that up.
And let us know.
Yep, cite your sources if you can find a source.
And comment. And it can be a hard copy book. Hard copy books are actually more accurate, more likely to be accurate than some website there's websites dedicated to flat Earth.
Yeah.
So
I mean, there's
you got to be cautious of what you read online.
Anybody can write anything on the internet. Just make sure it's a viable source.
Yeah. And a question of how often do you go to the dentist? That's our question.
Yeah.
And another question is, have you ever had anything dental that affected your other physical health? Is there anything that crossed over from the dental realm to your other physical realm, medical realm, that same thing with eye doctors. There's glaucoma that a eye doctor can diagnose.
Yes. But yeah, with the dentist, I knew somebody that did have a heart attack and had heart failure. And the cardiologist said it was because of his teeth.
Yeah.
And I also knew somebody else that had some liver disorder, and they weren't a drinker or anything like that. And he needed some surgery on his liver. I don't know if it was a transplant or what. I just was kind of half listening because I was at work trying to pay attention to everything else while he was talking to me. So I was trying to be polite and not tell him, hey, I'm at work. So I was half listening. But he said that his doctor wasn't going to do whatever he needed done physically until he had his teeth pulled because there was too much infection in his teeth.
And
whatever they had to do with his liver, whatever surgery that was, if they did that while he had infection in his mouth, that surgery would fail.
Gotcha. Yep, that makes sense.
And I also knew another lady. I knew a lady that went into the emergency room because she kept having headaches, really bad migraine headaches. And they told her it was because she had infected teeth and it was giving her a brain infection.
Oh, wow.
So they removed her teeth and the headaches went away.
Wow.
So the teeth affects a lot more than you would think.
Well, I was telling Laura Lynn this, I think he might have even died recently, I'm not sure. But we had one of our major channels, like Channel 4 or whatever.
Television channel?
Television, yeah. They had a man named Blizzard Bill, and he was the weather, what do you call the weather person? Whatever the weather person.
Meteorologist.
Meteorologist. He had, he was off of work for months, and it started with something with his teeth, and it affected his whole body.
Probably an infection.
And that's probably what it was.
And a root canal that's going bad can give you fibromyalgia symptoms.
How do you know if a root canal? I got a root canal. How do you know if it's going bad? Is there pain?
I watched a documentary on when root canals go bad, and it gives you
As
it's the
has
cat.
bad teeth too. She said that she's adding her 2 cents. She
Yep.
got bad teeth because she's 18.
She's 18. And so there was this guy, he was tired all the time, didn't have any motivation. He had rotating pains, like his knee would hurt, and then his hip would hurt, and then he would just start feeling
Talking, I think she wants.
tired and sick, and it would come and go. And he went to psychologists and medical doctors, and nobody wanted to do anything except for the psychologist wanted to put him on antidepressants.
Oh, you're always depressed no matter what happens. You go to a psychologist. You're
Yeah.
depressed.
So that was the only hope that anybody was trying to give. So he went to the dentist, and the dentist did an x-ray, and the dentist did a few things and told him that that he needed his root canal redone. Your cat wants down.
Okay, I'll put him back.
So they said your root canal needs to be redone. And he said, well, if the root canal is causing all of this problems, just take it out.
So take the whole tooth and the roots and everything.
Uh-huh.
Okay.
So they took it out, and he said that when they took that out, it gushed pus in his mouth. And he said it was so infected up there. It was seen on the x-ray. The x-ray showed it was infected. And he barfed on the dentist because all that pus just flooded his mouth. And he said that was so nasty because he said that was slowly seeping into his body. And his body was absorbing that through his tissue. And that was what was making him sick.
So when did you hear about, like, when that was all done? Did his body return back to normal, or
Yep.
was he permanently?
Nope. After that infection cleared up, because they gave him antibiotics and things like that to make sure that they cleared up that infection.
Yeah.
Once that infection was cleared up, his body did go back to normal, and he went back to surfing and all kinds of stuff that he was disabled from a root canal.
Yeah.
So people say dentistry isn't important. It
That's
is.
very important. Well, okay, so what makes me feel better, as you said, that it showed up on an x-ray. And my dentist does take x-rays when I go in there. So I'm thinking that they probably catch it.
Yeah, they should catch it because his showed up on the x-ray that it was infected.
Okay, and I go to the dentist every 6 months, so.
Right.
Yeah. Okay.
Yep. So if you have a bad root canal, it'll show up. It'll show up on your. I guess it gives a shadow or something. I really
Okay.
wasn't understanding how, because he had interviewed his dentist for this documentary, and the dentist said that he showed it on the X-ray and everything. I really wasn't following along very well with that.
Some of that gets a little too complicated.
Yeah, that was
into the weeds. And I was like, I don't know.
Right.
I understand up to this point, and then blah blah blah.
Blah blah blah. Yeah. So interviewing his dentist, even though I didn't understand everything the dentist was saying, it did contribute to my confidence in that he was being factual for his documentary.
Yeah, yeah. Well, a lot of these, I never heard anybody say dentistry was pseudoscience. Am I saying that right? Pseudo.
I think it's pseudo.
Pseudo. Okay.
And you're allowed to say it however you want. We have the Michigan accent in it. We don't talk like anybody else. So it's all
as
right.
long as okay. According to what's her name? She does the program on Sunday on NPR. Words Matter? No, I don't think it's Words Matter. That's what they say. Ann Curzan. She says you can say a word how you want, you can use any word you want, and as long as you're able to explain what you mean, you are using the language the way it was meant to be used, the way it was invented to be used. And if you're shaming somebody for doing that, then you are not using language the way it was meant to be used.
Language is just a tool for communication.
That's all it is.
Yeah.
And what somebody said, I was like, I can quit being a jerk. I don't have to say, well, actually, it's pronounced this, or actually, you mean infer instead of imply. I'm like, yeah, I can quit doing that. Because nobody wants to be around that person anyways.
So yeah, as long as you're communicating and you're getting your point across.
Yeah, and all you have to do, if you don't understand somebody, say, I'm sorry, I don't understand what you mean.
Exactly.
And I'll explain it.
And you're allowed to do that. And please remember that a lot of times when somebody is pronouncing a word incorrectly, it's often because they...
Or what you call incorrectly.
Right. Was commonly accepted, okay? If somebody is pronouncing something different than commonly accepted pronunciation, it's probably because they've never heard it spoke before. They've only read it.
Right, yeah.
Especially English. English is crazy.
Yeah, the way we spell, it's
awful.
I hear it's one of the hardest languages to use because we just, our spelling isn't consistent.
Like geography. I used to go in 7th grade, I had a new class called geography, and my mother was having a hard time figuring out what class I was going to, and I go, the one with the maps, and reading maps, and locations, and she said, that's geography.
Here's one. Biopic. I call it biopic. I was seeing it. I was calling it biopic.
Yeah.
Yes, I was like, and then I heard somebody jokingly.
Paradigm. Paradigm.
Oh.
Have you ever...
Do you have to answer that?
No, that's somebody trying to sell me something.
Oh.
The politicians have been calling me a lot lately, and I've been
Really?
getting a recorded message.
They haven't called my landline at all.
You're lucky.
I am lucky because usually they're calling. I'm surprised they're calling this early. What's?
I don't know what's going on.
Maybe there's some midterm or something vote or something because that's awfully early to be politicking.
This is Tim Wahlberg calling you. No, you're not calling me.
Oh, maybe it's their town halls.
Maybe. I'm like, yeah, it's not you. This is a recorded message. Yeah, ding dong.
Yeah, because every once in a while I'll just, because you can listen to their town hall through the phone.
Mm-hmm.
Every once in a blue moon, but I don't like Tim Wahlberg, so I just quit listening to his stuff.
He was a politician when I was a child.
Really? He's that old?
He's been a politician
Wow.
forever.
He was born a politician, I guess.
Because I remember when I was a kid and things weren't going my mom's way, she always blamed every politician. Anything happened, it was a politician's fault. Good old Tim Walberg
Sounds
did this.
like my grandfather. My
So-
grandfather did that. Or my father did that a lot. What little I seen of my father. My father. It's like, yeah, the dog barking next door. I don't think President Reagan has anything to do with that. It's like, the dog's howling because he's mad that Reagan's president. I don't know. I don't know.
Yeah, it's just like, oh my gosh, okay.
But I think we're getting more politically literate, now that we have the internet and access to all these podcasts and websites and stuff where it can be explained to us. I think we're getting better.
We are getting better, and we understand that just because Walmart is out of grape soda in the no-name brand, it's not the president's fault. He didn't go to Walmart and buy all the grape soda in the store brand, so you had to buy Welch's brand name.
He passed an order, no generic grape juice anymore. Yeah, I think they have better things to worry about than that.
Yeah.
So, anyways, it's 26:53, and I think that'll conclude this one. I think we run the gamut, unless you got something else to say.
Nope, we asked our questions and we gave homework, so we're good.
Okay, good deal.